A 75-year-old woman is brought to the emergency department after a motor vehicle accident. She was not seriously injured, but she reports that just before the crash, she experienced sudden dimming of her vision in her right eye, described as a curtain coming down, which lasted about 1 minute and then resolved spontaneously. She denies headache, chest pain, shortness of breath, or weakness. Her medical history is notable for hypertension and hyperlipidemia, managed with atenolol and simvastatin. Her temperature is 36.8 degrees Celsius, 98.2 degrees Fahrenheit. Blood pressure is 138 over 96 millimeters mercury. Heart rate is 78 per minute. Respiratory rate is 16 per minute, and oxygen saturation is 97% on room air. On examination, ophthalmologic evaluation shows narrowed retinal arterioles in both eyes. Neurologic and cardiovascular examinations are unremarkable. Which of the following is the next best step in management? Choice A, carotid duplex ultrasonography. Choice B, ESR and temporal artery biopsy. Choice C, transesophageal echocardiography. Choice D, intravenous corticosteroids. Choice E, cardioversion. Or choice F, discharge home with outpatient follow-up. I'll wait 5 seconds and begin answering the question. So this shouldn't be too hard. This is amaurosis fugax, which is a TIA, which results in unilateral vision loss. And the most common cause of this is a carotid artery stenosis. So you would do choice A, a carotid duplex ultrasonography, looking for the narrowing of the carotid artery. Not complicated, but they've asked about amaurosis fugax a fair number of times on the MBME before. So let's just take a look at some of these other answer choices here. Choices B and D, ESR and temporal artery biopsy and intravenous corticosteroids, both of these are referring to giant cell arteritis, which is a large and medium vessel vasculitis. Usually involves the temporary artery and cranial arteries. This can also present with an amaurosis fugax, but it usually also presents with a temporal headache and jaw claudication. ESR and CRP would be elevated. Now, if you suspected giant cell arteritis, choice B, ESR and temporal artery biopsy would be diagnostic. However, if you are actually suspecting giant cell arteritis, then choice D, intravenous corticosteroids, would usually be the correct answer, because you want to give corticosteroids immediately to patients with giant cell arteritis because you want to prevent potential permanent vision loss in these patients. Moving on, choice C, transesophageal echocardiography. So this would be for you trying to find cardiac sources of emboli. Cardiac emboli can potentially cause amaurosis fugax as well, and obviously they can cause stroke, but it wouldn't be your first choice here. Maybe if you had already done the carotid ultrasonography and you still weren't sure and you wanted to make sure, then yeah, maybe you would do the echocardiography, but you want to do that first. Now, of course, if they told you something that made you suspect that there was some kind of stasis in the blood, like an atrial fibrillation or something, maybe that would raise the odds or suspicion for you to do transesophageal echocardiography first. But anyway, it's the wrong answer here. Choice E, cardioversion. I kind of put this in here as a bit of a joke. I really hope none of you picked this. You would use cardioversion for various arrhythmias like atrial fibrillation. Aside from just cardioverting a patient for no real reason being a bad idea, in this particular case, you potentially make things worse even if she had an atrial fibrillation, because if you're suspecting that she's launching off emboli from the heart, then why the hell would you cardiovert them and potentially launch off another one? Choice F, discharge home with outpatient follow-up. This is the wrong answer no matter what's causing the amaurosis fugax. Pretty severe symptom to be experiencing, so you wouldn't just discharge them willy-nilly. Bad answer. So anyway, pretty simple question. It's actually pretty intuitive, right? Because if you get this weird transient loss of vision in one eye, you just suspect that, oh, I must have had a TIA, the artery got occluded for a short time, and you should go look at the carotid arteries and make sure everything's fine. I hope this video was helpful. I'll see you in the next one.